Hi, my name is Darshni and I'm going to talk about how Malaysia and United States tackled the COVID-19 pandemic which was ruling all over the world. Coronavirus disease was starts at 2019 and also known as COVID-19 is an infectious disease and also known as SARS-CoV-2. It was first identified in December 2019 in Wuhan, China and has resulted in an ongoing pandemic. The first confirmed case has been traced back to 17 November 2019, and we can identify the disease with some common symptoms include fever, cough, shortness of breath, loss of smell and taste. The virus is primarily spread between people during close contacts, most often via small droplets produced by coughing, sneezing, and talking. Less frequently, people may become infected by touching a contaminated surface and then touching their face, nose, or eyes. Measures to prevent infection include frequent hand washing, maintaining physical distance from others, quarantine yourself, especially for those with symptoms, covering coughs, and keeping unwashed hand away from the face. The use of face mask covering has been highly recommended by health officials in public settings to minimize the risk of spreads. And according to the World Health Organization, there are no vaccines nor specific antiviral treatments for COVID-19. Yet, social distancing strategies aim to reduce contact of infected person with large group of closing schools and workplace, restricting travels and cancelling large public gatherings. Distancing guidelines also include that people stay at least 1 meter apart. Implementation of social distancing and stay at home orders, many regions have been able to sustain an effective transmission rate. Come to the point on where how Malaysians and United States tackle the COVID-19 pandemic, and first we're going to have a look on United States on how they are suffering and handling this COVID-19 pandemic in their country. As we all know, there are recorded cases which is 2,356 and 657 cases, and that is all upon 122,247 cases and 980,355 dead cases. Whenever US cities have tested a subset of the general population, such as homeless people or pregnant women, they have found at least some infected people who aren't showing symptoms. And as ProPublica first reported, there has been a spike in the number of Americans dying at home across the country. Those people may die of COVID-19 without even entering the medical system, meaning that they never get tested. This is clearly some group of Americans who have the coronavirus but who don't show up in official figures. Now, using a statistic that has just become reliable, we can estimate the size of that group and peak. According to the Tracking Project's figures, nearly 1 in 5 people who get tested for the coronavirus in the United States is found to have it. In other words, next we're going to have a look on Malaysia overview, which is 8,572 cases are confirmed and 8,156 cases are recovered, and 121 cases are in death. The country recorded its first 2 deaths from the disease in the mid-March, in which one of them had previously attended public event in Sri Petaling. Malaysia gave enacted a partial lockdown on 18 March and has since extended the initial 2 weeks MCO twice. Anticipated Ramadan bazaars typically held yearly throughout the whole fasting month. They are following the South Korean model to test everyone. The MCO has been strict on Malaysians, with over 9,000 people arrested for violating the orders as of 14 April. According to local media, the government has working hard as possible to normalize the situation in the country. They have a strongly course which is says stay home, stay safe and stay strong, which makes them to win the battle against COVID-19. And thanks for watching my video regarding the struggles and the steps taken by the two countries to fight against the COVID-19, and the comments are most welcome. Thank you.